Hey guys, ECRG here, back with another episode. Today we're going to be talking about what is source document review, or SDR. Now this is different from SDV. I'm going to do a completely different video on SDV and source data verification. But source document review is something that CRAs do on site, or good CRAs should do on site. A lot of times it does not get done. A lot of times CRAs just do SDV, source document verification. So a lot of people have heard about that, 100% SDV or 70% SDV. You may have heard about that, risk-based monitoring. But lesser known is SDR, source document review. And I'm going to give you guys a definition of what that is right here. So SDR is defined as the review of source documentation to check on quality, compliance, staff involvement, and other areas that aren't associated with a CRF data field. So this is when you go on site, when a CRA goes on site, and this has to be conducted when you have the source documentation. And this source documentation is only held on site. And a site is going to use that source documents to upload information, key information from those source documents into the CRF field. That's an EDC system, like metadata rave. So they're going to use information from those source documents to input data that the data management and the study team wants in metadata rave or other EDC platforms. So what is source document review? What does the CRA have to do with this? Well, there are a bunch of documents in the source documents they're going to be like fields, maybe summary pages that the study coordinator is going to fill out that are going to document some of the testing that's been done, maybe put in some of the key lab values and things like that. But the thing is, though, transcription errors can happen. So when you get a printout from an EKG machine and they want you to input that information onto another source document, like a paper that has like key fields on it, there can be some transcription errors. Or let's say there's a patient that has a diary log and they list some headaches, constipation. They list some of those things which could be considered AEs, adverse events. They list those on there, and those aren't transcribed to the AE log, or they're not transcribed, or the physician didn't talk about them in their physician notes. So it's up to the CRA to reconcile all these things, to cross-check. You need to check the ConMeds log. They need to check the AE log. They need to see if the doc has mentioned it in their progress notes, or the study coordinator has mentioned it in their progress notes. They need to check the patient's diary to see if they talk about it there. So all of this has to be cross-checked with each other, and that's what's called source document review. It is the cross-checking and reconciling of source documents to make sure the information lines up and that a story can be made available, that everything makes sense in the CRA's mind and in the study team's mind. So that is source document review, and that is something that not a lot of CRAs do all the time. And they really should, because you catch a lot of mistakes that are made. You catch a lot of things that happen in the study when you do good source document review. And really it should be done before source data verification. That's why I'm doing this video beforehand, the SDV video. Source document review should be done before SDV, because by the time it goes into the CRF, then you've got to issue queries and all that stuff. So you really want to catch these mistakes and reconcile these differences before it even makes it into the EDC, if possible. A lot of times that's not possible because study coordinators are inputting data, right before you come on site and things of that nature. But you definitely want to make sure that these errors are checked and proper things happen, whether it's protocol deviations, whether it's action items or queries later on down the line. So that is source document verification. Hope that explained that well. Hope you guys get an idea. This is something that you really, if you haven't had any interaction with source documents, whether you're not a study coordinator, or maybe your study doesn't have any electronic source documents review available, or if you're a CRA, you would know about this. But this may be a little bit hard to understand if you haven't been on site before. And that's just the nature of it. So try and go on site before. If you haven't, then this will make a lot more sense. So hope this video was great, guys. As always, email me eliteclinicalgroup@gmail.com for any inquiries you may have. Resume review program, any kind of interview prep. Maybe you guys are interested in that. Email me there. Take care.